Hey, I'm Lindsay. I'm the nurse practitioner that's going to be taking care of you today.
Hi, nice to meet you. I'm Allie.
So I'm going to be doing a physical exam today, and I'm going to be talking about everything as we go through. Do you have any questions?
Not so far.
Are you comfortable?
I am very comfortable.
Good. So first of all, I'm just looking at your overall appearance. You don't seem to be in any distress or discomfort. Your overall hygiene seems to be really good. I don't really notice any odors, which is good as well. You're well groomed and appropriately dressed. I also noticed that your overall muscle tone appears to be equal. I don't notice any fasciculation or any twitching, which is good. So, and no tremors either, so I like that. I'm just going to assess your mental status now, okay? So can you tell me your name?
My name is Allison Burgoyne.
Okay, and where are we?
We're in Connecticut.
Okay. And what are you having done today?
Physical exam.
Okay. And how much money is in 6 quarters?
$1.50.
Okay, good. Very good. So now we're just going to move on to your skin. Your complexion is appropriate for your ethnicity. There are no color changes or abnormal pigmentation. The texture is soft on both your arms and your legs. So I'm just going to use the back of my hands to check the temperature. And it's nice and warm, so that's good. It's also dry, which we want to, but not too dry. So I'm going to pinch your skin here. This is called a Turgor test. There's no tinting, so it lets me know that you're well hydrated. So I just want to be sure that I check your back as well. And I don't see any suspicious nevi or moles or anything like that here or on the rest of your body. I'm sorry. There's also no lesions, eruptions, or scars or birthmarks that I see. I do see just a couple of macules, which are freckles on your shoulders and a couple on your face, but that's nothing I would refer you to dermatology for. They're actually kind of cute. So can you show me your hands? So I just want to look at your nails, and they're nicely painted, very cute. And I'm just pinching each one, and they're clean without lesion. Capillary refill is less than 3 seconds. There's also no clubbing or any other abnormalities, which is good. So move on to your head now. I'm just going to run my fingers through your hair. And your scalp feels nice and smooth. I don't notice any lesions or nodules. The texture of your hair is very soft and silky. I'm jealous. Yeah, it's evenly distributed and there are no infestations, which is good. Move down to your eyes. So I can see your lashes curl upwards, which is good. There's no ptosis or drooping of your eyelids. There's also no crusting, edema, or erythema. That's good. So I just want to check your bulbar and palpable conjunctiva. Just going to pull down. Can you look up for me? All right, good. And now, can you look down? Very good. Okay. Good. So they're pale as they should be. There's no injection. Also notice that your sclera are nice and white, as they should be. There's no lesions, sorry. Your iris is nice brown color here. Their clear line of demarcation and the color is even bilaterally. That's good. So just want to take my flashlight. I'm going to be looking at your cornea here. And they're clear. There's no lesions, arcus, or scarring, so that's good. So I have this out. I'm going to use this to check the size of your pupils, okay? And they look to be about a 4 right now, bilaterally. They're also regular, round, and equal. And now I just want to use my light to check your cranial nerve 3. That's good to check your reaction to light, or the response to light with your pupils, okay? First, I'm just going to check direct response. Just going to shine my light in your eye. Perfect. And they constrict. Beautiful. To 1. Actually, they constrict really good. Oh, yeah, they get really small. And now I'm going to check direct response. So I'm just going to put my hand right here to block the light from the other side, okay? And as I shine it in this eye, they both constrict, and that's good. And good. So both direct and consensual response are intact. So that's good. So now for accommodation, I just want you to look at my finger. Good, they constrict, and now look at the wall behind me, but don't move your eyes. Good, they dilate. And now look right back at my finger. Perfect. They constrict. So that is a combination and it's intact. So you're doing good. Good. So now I want to check your extraocular movements. So all I want you to do is don't move your head, but I want you to follow my finger, okay? We're going to go through the 6 cardinal fields of gaze. And I'm looking for any nystagmus at the extremes. And I don't see any, so that's good. So that's cranial nerves 3, 4, and 6 that are all intact right there. So now I'm going to check your optic nerve, which is cranial nerve 2. I'm going to use this Snellen chart for that. So, do you wear glasses or contacts?
No.
Okay. So I just want to hold this 2 feet away, this chart, okay? So what I want you to do is just read the smallest that you can read.
Okay. LTEPH.
Okay, now cover one eye.
LTFPH.
Okay, and switch.
LTFPH.
Beautiful. So you read 20/20 with both eyes, and you have perfect vision. So next I'm going to check your visual field. So I'm just going to be standing right in front of you, and I want you to cover up one eye, and I'll close the opposite. And I just want you to let me know when you see my fingers, okay? So just cover an eye. Okay, so I'm going to close this eye. Let me see it.
Yep.
See? Over here.
Yep.
How about over here?
Yep.
Over here.
Yep.
Switch. Switch. Okay. Tell me when.
Yep. See it. See it.
Yeah.
Yep.
Okay, good. So I'm going to move to your ears. Ready?
Mm-hmm.
So I'm just looking at the external ear here. There are no lesions, cerumen, or earwax. And next I'm just going to palpate the auricles. Is there any pain?
Nope.
Okay, how about in your pinna?
No.
Okay. How about in the tragus?
No.
No? And how about the mastoid process?
No.
Okay. Very good. So I'm just going to look inside your ear. Use a little auscultation here. I'm just going to pull your ear up and back.
Mm-hmm.
So your tympanic membrane is intact. They're nice and clean in there. It's a pearly gray color. The cone of light is about 5 o'clock, which is normal as well. And I also see the ink is in the eyes, so that's good. Let's see the other. Perfect. Same in this ear, and the cone of light is about 7. Okay. Sorry. I'm sorry.
There you go.
So I'm just going to touch your cranial nerve. 8. So I want you to just clear the mirror. Okay. And now I'm just going to say a two-letter word, a syllable word, and I want you to repeat it. Apple. Apple. Okay, and switch. Chicken.
Chicken.
Good. Moving on to the nose. I'm just going to palpate the external structure. Any pain?
No pain.
No, I'm just going to peek inside my eye scope. Tilt your head back. Good. No lesions, deviations, or perforations of the septum. The mucosa and turbinates are nice and pink. There's no drainage. So let's skip the mucosa. Good. Same. Sorry.
No, good.
I'm just going to palpate your frontal and your maxillary sinuses. Just let me know if there's any pain. Any pain?
No pain.
Okay, good. So, all right, so can you smile? Show me your teeth. Good. Cranial and wrinkle your forehead. Good. That's cranial nerve 7. I notice that your lips are well hydrated, but I don't see any lesions.
Mm-hmm.
So I'm just going to use my light here and my tongue blade to look inside your mouth. So just keep your mouth relaxed a little bit, and if you need to swallow, that's okay. All right? So just open up. If the corners are nice and clear, I'm just going to use my tongue blade to move my lips so I can see your gums and teeth a little better. There's no lesions, missing teeth, bleeding gums, erythema, or edema. You can swallow if you need to. Sorry. There are no repairs, which your teeth look really good. The buccal mucosa looks really good. There's no lesions, so just say ah for me. Ah. Beautiful. Okay. There's no lesions on the hard or soft palate, which is good, and the uvula rose and midline. And when you said off, so that's normal, that's cranial nerves 9 and 10. Okay? So let me look again. So there's no lesions, erythema, swelling or exudate on the tonsils or on the posterior pharynx. So that's good. And your tonsils are like between a +2 and a +3. So that's normal. Okay, so just stick your tongue out straight for me. Good. So it's normally palpated and midline, and that lets me know cranial nerve 12 is intact. And if you could lift it up for me. Good. There's no lesions or coating on the tongue, and your salivatory glands are patent and intact. So that's good. And no lesions. So we're going to move on to your nose now. So I'll be looking for any enlarged nose or tenderness or anything immobile. Okay, so just let me know if there's pain, but otherwise you don't have to say. So I'm just going to start by palpating in a circular motion at the preauricular, postauricular, occipital, tonsillar, submandibular, submental. You okay?
Mm-hmm.
Superficial cervical. And moving down the sternocleidomastoid, the deep cervical chain, posterior cervical, supraclavicular, infraclavicular. Let me just see your arm real quick. Just good. And the epitrocular. So those are good. So I'm just going to check your neck. I'm just going to find your sternal notch here. I'm going to palpate up on both sides. And I'm just inspecting the trachea, making sure that it's midline. And it is. There's no swelling under the cricoid cartilage that would signify an enlarged thyroid. So I'm just going to palpate from behind now, making sure that my hands are cupped around the sternocleidomastoid muscle at the cricoid cartilage right there. And I'm going to just press it on this side. You okay?
Mm-hmm.
Okay, can you just swallow for me? Good. And now the other side, just swallow. Good. Was there any pain with that?
Mm-hmm.
Very good. Okay. So I could feel the thyroid move up and down, and there was no tenderness or nodules or anything like that. So you don't have an enlarged thyroid, which is good. Right. So just turn your head that way for me. Good. I'm just going to palpate. Your carotid pulse here. It's present in about a 2+. And if you just turn this way, I'll take the other side. They're equal. Very good. Now I'm just going to listen to him, okay? I'm going to use the bill of my stethoscope for this. So, just going to palpate to make sure I'm on the right spot here. You can just turn your head for it. Perfect. Take a deep breath and hold it. Okay. And now the other side. Just turn towards me. Okay. Take a deep breath. Perfect. No bruise. That's good. Okay. Turn every one to your chest. So I'm just going to inspect. I'm looking at your AP to lateral diameter, and it should be about a 2-to-1 diameter ratio, which it is. There's minimal respiratory effort. There's no use of accessory muscles or retraction in the spaces. And while you weren't paying attention, I counted your respiratory rate, which is about a 14. So now I'm just going to systematically percuss your lung fields, okay? So you just relax. I'm just going to listen for resonance. Oh, okay, so right here, the sound changed from resonance to dullness. Mm-hmm. So that lets me know that I hit something solid. And so in this case, it's your diaphragm. So it's totally fine. That should be there. So now I'm just going to listen to your lungs in the same fashion, okay? Mm-hmm. Okay, so now I'm just going to systematically percuss the lung fields, okay? On your back. So that just means tapping. I'm listening for resonance, okay? Okay, so right here, the sound changed to dullness, which lets me know that I hit something solid. And in this case, it's your diaphragm, so we're okay. Nothing bad there. That's good. Now I'm just going to listen for adventitious breath sounds in the same fashion, okay? So whenever I put my stethoscope on your back, I want you to take a deep breath, okay? Okay. Okay, go ahead. Squeeze normal. Okay. They're equal anteriorly and posteriorly. The bronchi, wheezes, they're clear and vesicular bilaterally. So now I want to check for transmitted breath sounds. Bronchophony and echophony. So I'm going to listen again, but each time I put my stethoscope on your back, I want you to say the number 99. Okay? So you're going to say a lot of times. Okay, go.
99, 99, 99, 99, 99, 99.
Okay, now say the letter E.
E.
This checks the cacophony.
E.
Perfect. So I'm just going to check for CVA tenderness when I'm back here. So I'm just going to put my hand here. Is there any pain?
No pain.
Any pain there?
Nope.
Okay, perfect. So no CVA tenderness. Also no transmitted breath sound. So that's what you want to hear, muffled noises, and that's what I heard. I couldn't hear it.
Cool.
So the breast exam. Most of it's going to be explained, but there's a couple things that you can do. So first of all, I would just inspect. I would be looking at the breasts and the nipples, looking at the size and the symmetry and the contour. Look at the skin, and the texture to see if there are any lesions. So I'm just going to start here so we can do this part, okay?
Mm-hmm.
So I just want you to put your hands above your head. Okay, good. And I'm just looking with your hair. Okay. So can you just put your hands on your hips and press down for me?
Mm-hmm.
Okay, good. And now lean forward. Very good. And now just no dimpling or retraction. So I can see that. So just leave your hands on your hips right there for me. I know you're a little ticklish, so I'm just gonna try the central nodes.
Mm-hmm.
Okay.
Mm-hmm.
Lateral, right here. Pectoral are right here.
Mm-hmm.
And subscapular are back here. Okay, so that's good. So I'm just going to explain the next part. This would be what I would do in the examiner. So I would have you lay on your back so I could palpate the breast. I would have you put your arm above your head for each breast. I would start at the tail fence, and I would palpate in a circular motion in toward the areola and the nipple. Feeling for any masses or tenderness, then I would gently pinch the nipple, looking for any discharge or pain. I know it's really great. Yeah. But you can actually do this yourself in a shower, so I'll let you do that. Perfect. So, a monthly is usually recommended after your period, okay?
Mm-hmm.
All right. So before I have you lay down, I'm just going to check a couple other things. I want to look for an aortic murmur, okay?
Okay.
So I'm going to use the diaphragm of my stethoscope, and I'm going to put it on the aortic area. So if you could just lean forward for me. Now hold your breath. Perfect. Okay. So now I'm just going to have you lay back on the table. If you could just scoot back, make yourself comfortable. That's good. I'm going to switch to the bell of my stethoscope now. And I'll place that on the mitral area right here, okay? So I'm just going to have you roll onto your left side if you can. Okay. Just relax. Okay. Perfect. And I don't hear you. Okay, so you can roll back over on your back. I'm sorry, I got you rolling around. So, you're over 30 degrees, which is good, so we want that for the next thing. Take my light here. Can you just turn your head that way? Using the light. And I can see the pulsations of the jugular vein. Very good. It's actually very good there. So now I just want to measure from your sternal angle. And this helps me estimate internal jugular venous pressure. I'm just going to place my hand here on the sternal notch here. Slide my fingers down here, and I feel the ridge. Mark that spot right here. And now I'm going to measure to the highest pulsation. And yours is about 4.5, which is normal. Good. So now I'm just inspecting your chest, or your pericardium, which is another word for it. And I don't see any heaves or lifts, anything like that, that I would think you had an enlarged heart. Now I'm just going to palpate for any thrills or pulsations. So here is the aortic, pulmonic, and these are both the second intercostal space. And now the tricuspid on the lower left sternal quarter, and now the mitral between the fourth and fifth intercostal space right here. Very good. At the midclavicular line here. Okay. So I'm just going to use my diaphragm, my stethoscope, and I'm going to palpate. I'm going to auscultate in the same place as the palpator. Okay.
Okay.
All right. So we have the aortic, pulmonic, tricuspid, mitral. But S1 and S2 are present. We have a regular rhythm, so I'm going to use the bell of my stethoscope and go in the opposite direction. Mitral, tricuspid, pulmonic, and aortic. And I didn't hear anything abnormal like S3 or S4, so that's good. So now I'm going to show you how we would do the apical pulse. So what I would do is I would place my hand right here on the mitral area, and I would leave it there for 60 seconds to actually count the rate in the rhythm. Okay? Okay. So now moving on, we're going to do the peripheral vascular. So all I'm going to do is palpate the pulses throughout your body. So I'm just checking to see if they're symmetrical and have normal amplitude, okay?
Okay.
All right. So I'm going to start here at your temporal. Okay. Your radial. Okay. And now this might tickle, but I'm going to do your femoral pulse here. Sorry. Sorry.
I'm ticklish.
And while I'm here, I'm going to check your angle and nose. So that's good. Okay, so that's good. So I'm just going to lift your leg here. You bend your knee. I'm going to check the popliteal pulse. Good. I can feel it. You can't feel it in everybody, but I can feel yours. So while I have your leg up, I'm going to inspect for any arterial insufficiency or any varicosities, and I don't see any, so that's good. Just a little baby bruise. And now the dorsal pedis and the posterior tibial. Okay. And I'm just going to palpate real quick for any edema. There is none. So your pulses are about a 2+ and equal throughout your body, so that's good. So now we're just going to move on now to the abdomen. I'm just going to have to expose your stomach a little, but I also need you to have your head a little bit flat. So we're just going to switch pillows if you want to scooch back a little. That'll be good. Are you comfortable?
Very comfortable.
Okay, good. Let's lift your shirt up a little bit, okay? Make sure you're nice and covered over else. So I'm just inspecting. I'm looking at the contour, and yours is flat, which is nice. I don't see any rashes, right? There's no scarring, so that's good. Nothing indicating any surgery. So I'm just going to listen to the 4 quadrants, okay? Okay. Perfect. We have vowel sounds times 4. So now I'm just going to switch the bell of my stethoscope, and I'm going to listen for your aorta and your renal arteries, okay? Aorta. Good, so I don't hear any bruits, so that's good. I'm just going to percuss the abdomen now, so I'm listening for sounds on tympany, which is just air. Any pain?
No pain.
Good. So now I'm just going to lightly palpate the abdomen. Any pain? Okay. Now I'm just going to deeply palpate. Any pain?
No.
Okay. I'm just going to palpate your aortic span too as well. And yours still to be about 1 centimeter, and that's normal. So I'm just going to lightly palpate your flanks. I know that you're a little ticklish, but I'll be careful. Any pain or tenderness? Okay, so now we're going to go deep. I'm sorry. There we go. Obviously no pain if you're laughing. That's good. I want to just, actually, I'm sorry, I'm going to do this again. I'm just going to palpate for liver span, okay? I'm going to start low here. And I'm looking for my tympany to turn to sounds of dullness. That's dull. So I'm going to mark that spot. And now, could you just hold your breast up for me a little bit? Just pull. Okay. So I'm going to start here. And tympani. And dullness right there. So the spots between the two spots of dullness is the liver span. Yours is actually about 5. So that's normal. It's a little bit smaller. It's usually about 6 to 12 is normal, but I'm not measuring either, so it's normal. I'm just going to go here on your coastal margin here. I'm just going to palpate the liver. Can you take a deep breath for me? This is the edge of the liver. Just breathe. And breathe again. Good. Normal. Now I'm just going to percuss on the other side here for signs of an enlarged spleen, okay? Just going to start medially and move laterally past the mid-axillary line. Tympani throughout, so that's good. So I'm just going to palpate your spleen, so I'm just going to have to reach my hand over here. You just lay back. Okay, just now take a breath and breathe out. And breathe again. Good, and breathe. Good. So a normal spleen is not palpable, so I cannot palpate it, so it's not enlarged, so that's good. So now I'm just going to do some special maneuvers to determine if you have an acute abdomen. So I'm just going to press here and up. Does that hurt?
Nope.
Okay. So that's a negative rebound tenderness test, so that's good. I'm just going to put some pressure on your right leg. Just try to lift it up. Good. Is there any pain?
Nope.
Perfect. That's a negative, so it's fine. And now I just want to lift your leg here and bend your knee. And I'm going to internally rotate your knee. Is there any pain? Perfect. So that's a negative obturator sign. So that lets me know that there's no problems with the appendix. So those would let me know that if you may have an inflamed appendix or possibly appendicitis. Okay. So that's what we just checked. There's 3 things to check. So moving on to the musculoskeletal exam. Are you okay? Okay. So we're halfway through. Okay. So we did a little bit out of order because you're already laying down. So I'm just going to start with the hips first. That's not really normal, but I'm going to do this way. So first I'm just going to palpate the greater trochanter on both sides. Is there any pain here?
No pain.
Great. So now I just want to check range of motion. I'm just going to my hand on your pelvis for support. Just want you to lift your leg up for me and bend your knee. Good. That's flexion. Any pain? Also, no crepitus or crunching here, so that's good. So now I just want you to roll on your side for me. This will be quick. Okay. And I'm going to pull back on your leg. Any pain? Perfect. That's extension. You can roll back on your back. I'm sorry, scooch back a little. Okay, perfect. Okay. So I'm just going to lift your leg here. Now I'm going to internally rotate the knee again. And now external rotation. Good. Good. And now we're just straighten your leg. Okay. And abduction. Adduction. Wonderful. No pain?
No pain.
And no crepitus as well, so that's good. I would then repeat that on the other side, but we're not going to do both. So now moving on to your ankles. The landmarks here are the medial malleus and the lateral malleus. Here, these little things. Now just point your toes for me. Good, that's flexion. Now pull them back. That's extension. Perfect. And now I just want you to turn your ankles in like this. That's invert. And out is evert. Very good. Any pain?
No pain.
Okay. So I'm just going to palpate the bones of your feet, starting with tarsals, these things here. And then the metatarsals. Your MTP joints. The PIP joints. And the DIP joints right there. Perfect. So just curl your toes into a ball for me. Perfect. That's flexion. And then bring them back out. That's extension. And now spread your toes apart. That's abduction. And back together. That's adduction. Good job. You're doing good. So that's most of the lower extremities. I'm just going to have you set up at the edge of the table for me. And we'll finish with the knees, okay? All right. Just flip those things. All right. Comfortable? So I'm just going to palpate the landmarks here. So on either side of the knee here, you have the femoral condyle right here. You have your tibial condyle, your tibial tuberosity right here, your lateral joint space, and your medial joint space. Is there any pain in any of them? Perfect. Okay, so just straighten your leg for me. Good, that's extension, and bend it back. Good, that's flexion. Beautiful. Any pain?
Nope.
That's it for the lower extremities. So we're going to go back up to the top. Okay, we'll start with the temporal mandibular joint. I'm just going to palpate here. Can you just open your mouth for me? Perfect, and close. Okay. Any pain?
Mm-mm.
I also didn't feel any clicking or anything like that, so that's good. Can you just turn your head that way for me? I'm just going to palpate your cervical spine. Just making sure that it's in a straight line here, and it is. I'm also going to palpate the paravertebral muscles here. Any tension or pain there?
Mm-mm.
Okay, you can just check the range of motion now. So just going to follow me, okay? So let me know if anything causes you any pain. Okay, so follow me. So first I want you to go chin to chest. Beautiful. That's flexion. Up at the ceiling. Good. That's extension. And now your shoulder for lateral bending. Good. And now rotation. And the other side. Beautiful. Good. So you have full range of motion of the cervical spine, so that's good. So now I'm just going to check the range of motion on your shoulder. So I'm just going to look at the landmarks first here. So I'm going to palpate the landmarks. Okay. So if there's any discomfort, let me know. So we have the acromion clavicular joint right here, and the gleneal humeral joint right there, and the bicipital groove, which is right here. And you actually have muscles, so I can feel it. So you can just follow me. Ready? So we're going to flex your arm 90 degrees, and then 180. Beautiful. And then bring it back behind you for extension. Good. And now bring your arm out to your side. Abduct. Good. And now bring it across your chest for adduction. Adduction, I'm sorry. And now try to reach beside your back to the opposite shoulder blade. Good. That's internal rotation. So that's good. So now I'm just going to have you put your arm out like a wing, like this, with your elbow bent. And now raise it like high five. Good. And that's external rotation. So that's good. Anything? Okay, you put your arm down. So I'm just going to look at your elbow now. And you have the humeral epicondyle here and the olecranon process right here. So just follow me again, okay? Stick your arm out in front of you like this. Perfect. And then flex. Good. All right. That's extension. Flexion and extension. Okay. Okay, perfect. So hands out, palms up. This is supination. And now palms down. Pronation. Very good. So moving on to your wrist, you put this arm down. I'm just going to steal this arm. Just going to feel your landmarks here. And this is your ulnar styloid and the radial styloid right here, which are both landmarks. So now I'm going to palpate the carpal bones, which are right here. Is there anything?
Nope.
Perfect. So just copy me, okay? Put your hands up. Hands up. Flex. Hands down. Extend. Okay. Moving to the side like this. That's ulnar deviation. And in towards the thumb. If I keep straight, that's radial deviation. Anything? Perfect. Sorry, excuse me. Very good. Now we're going to move on to your hands. I'm just going to palpate each of your metacarpals. And your phalanges. Here. And the MTP joints. The PIP joints right under. And the DIP joints. Good. Any pain on those joints? Okay, good. So just follow me again. Like this. That's flexion. Open them. Extension. Very good. And now spread your fingers for abduction and together for adduction. And now hide your thumb for me. Like this. That's flexion. Back out. Extension. And now adduction and abduction. And now opposition. Good. Finish with hands. It's Brittany. She has a different sound. So, like it's like a chime. We're almost done too. She's an idiot.
Oh, she texted her.
Yeah. Oh, she's stopping because she's not doing hers like mine. She has a better like program.
Oh.
Okay, so anyway, that concludes the upper extremities. So, here we go. All right. So we're gonna do your reflexes. So I'm just gonna let your arms angle here. Angle, angle, angle. Oh, good. And now for your biceps, I'm just gonna hold your arm here. I'm just gonna hit my own thumb here, and I should be able to feel it twitch. It twitches. And now the brachioradialis, which is right here, and I should just feel a twitch. There we go. Okay, so lower extremities, you have the patellar, right here. Good. And I'm going to dorsiflex your foot here, so the Achilles, and you should flex too. I'm going to use the blade, and there's, I'm sorry, to go a negative Babinski. Remember when you were a baby and you hear the Babinski? I'm going to kill her. She's going to edit this shit for me. Okay, so negative Babinski. All right. Your reflexes are intact. So before I have you stand, I want to check your coordination. So I want you to take your hands and I want you to go really fast. Okay, good. Now I want you to paddle your feet. Perfect. That's good. You have good coordination. That's the coordination portion of your cerebellum, and that's intact. So now I just want to set your spine. So I'm going to have you hop up. And if you can stand right there for me on the little circle, that'd be great. Perfect. So if you could just bend over, try to touch your toes. I'm just going to raise your shirt, okay? This is flexion. Just stay there for a second. Just going to palpate the paravertebral muscles here. You're not getting a massage or anything. I'm going to check your vertebrae. Good. Any pain? Nope. Good. And now your sciatic notch. Any pain? Nope. Okay, perfect. There's no kyphosis, lordosis, or scoliosis, so you can just bend backwards for me. You can sit, you can look at me. Turn around. You want to just lean back and look at the sky for extension. Good. You can lean back. Good. And now just I want you to laterally bend and try to touch your leg. And the other side. And the other side. And now rotate. Like twist. Good. And the other side. Perfect. So now I want you to look at that way and take 5 little steps that way. Okay? Good. Your gait is normal. So when you turn around, I want you to walk heel to toe for me. Okay. Good. You can stop. Perfect. And now just put your feet together and close your eyes. Put your hands at your side. Okay, and just a minute. So I would do that for 20 seconds, and this is called the Romberg test. And there's no swaying or drifting, or big swaying or drifting. So that's good. You can open your eyes. So for shoulder girdle, just want you to put your hands out in front of you, either palms up towards the sky, and leave them there for a second. Good. There's no drifting or pronation, so that's good. So you can actually get back on the table. We're almost finished. I just want to check cranial nerve 5 real quick. It's the trigeminal. I'm using a swab on your face, okay? So there's a soft side and a sharp side. Sharp, soft. Close your eyes. I'm going to tell you what they are. This is soft, and this is sharp, okay? So as I touch you, let me know, okay? What you feel, soft or sharp, okay? Soft. Sharp. Sharp. Soft. Sharp. Soft. Okay, good. So I'm just going to do your extremities too while I'm doing it. Hard. Soft. Hard. 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 Soft. Hard. Soft. Okay, good. So I'm going to check vibration sense real quick so you can open your eyes. So I'm going to grab a little tuning fork here. I'm just going to strike it, and then I'll have you like stick out your hands, close your eyes, and I'm going to place it on your finger. And I want you to let me know when you feel it start and when you feel it stop. And I'm going to do it on your fingers and your toes. Okay? So close your eyes. Started. Stop.
Stop. Started. Stop.
Okay. And feel it.
Started. Stop.
Okay. So I'm down here. Now just close your eyes. Let me know if your toe is up or down, okay?
Up. Down.
Hands out, eyes closed. Okay? Fingers up or down, okay?
Down. Down.
Very good. Okay. You can open your eyes now. No, you did good. So I just want to test your muscle strength, okay? So I'm just going to press on your shoulders. So try to shrug them. Good. And now your face, look at me. That way. And turn into me this way. Harder. Good. Okay. So cranial nerve 11 is intact. So now I just want you to stick your hands out and make muscles like this, okay? Don't let me pull down. Good. Now push out that way. Good. And now in. Good. Perfect. And now I'm just going to push down there with knees. Just try to push up. Good. And now try to push down. Good. And now push out. And now pull in. Good. And now push up with your feet. And push down with your feet. Good. Okay. So now I want you to, okay. Fine. So just take my hands and squeeze them. Good. That's equal strength. And now just let me see this hand. This. And you're all done.
Oh.
Thank you.
Oh, you're almost
You did so good. Oh my God, I'm sorry.
That's so funny.
Ugh.
I'm trying to remember all these things you're saying because I'm like, oh, I should probably memorize them.